Hola amigos, bienvenidos a Hola Tejas. Les habla Mireya Garcia. And this time around, Hola Tejas was out of the studio. We were out on assignment at a community action health clinic in Mathis County. And this is a really interesting way to deal with healthcare, especially in rural areas. We met there with a group of people from the community who talked to us about how this clinic has helped them. And two prominent Congress members were there as well from your area and as well as California, trying to see how they could help with these community action centers and keep them growing. Let's take a look.
We're engaging in filming of something that is very near and dear to my heart, which is administering health care to the sick and to people throughout the lifespan. We've got a great clinic and a great model in community action. The great people that work out there, that devote their lives to having clinics throughout South Texas, to reaching those that are medically underserved, is something wonderful. And we had an opportunity to go out to one of them in Mathis, Texas, adjacent to a school. And we had some VIPs, some United States congressmen that went to tour the facility, and it was just something magical. When you see a healthcare delivery system that also is next door to a school and not only takes care of the children but takes care of people throughout the lifespan, this is a model that works. So let's go to that and see what Diamond Dave brought us on TV Land to educate us on a healthcare model that works.
Well, I came from private practice. I was a sole provider of behavioral practice and was recruited to come and work in another one of our programs. And then I came on to work with the healthcare programs, and it has just become a passion to bring healthcare services to the rural communities of South Texas. As we see what it means to people to be able to access quality health care that's affordable to them. We hear so many stories from some of the physicians that have come from private practice that say they used to find the prescriptions on the ground outside of their offices, because if they were able to pay, the uninsured particularly, if they were able to pay for the office visit, they couldn't get their meds, they couldn't get their lab work. So they come here, and as a federally qualified health center, we're able to access 340B pricing, which is offers our patients discounted medications and discounted labs. So they're able to receive comprehensive services.
I think from the inception of the project, we had some pretty lofty goals, but what we've been able to do here really has far surpassed what we thought we were going to do. We initially began working with the Mathis ISD in an attempt to increase their ADA, to decrease their absenteeism, and the superintendent and the board thought that health services would be a way to do that. So we partnered with the district to open a community-based health center with $125,000 from the state of Texas. We were self-sufficient within 3 years. The community health center sees about 1/3 of the students enrolled in the ISD here. We also see the teachers, the parents, and the surrounding community. So all in all, we see maybe 1,900 people in this community health center. It's a true partnership between a nonprofit agency and the local independent school district.
We need to develop our behavioral health program. We need to outreach to more of our communities. San Patricio County, for example, where we are right now, is a very large county, and it's spread over a very large area. We have 2 small community health centers in Sinton and in Mathis. We have a population that's growing as a result of the growth of the port and the Eagle Ford Shell into the Aransas, Rockport area, some of that area. The population is moving in that direction. The companies are bringing employees in. So we are seeing a great need to expand into those areas.
We provide a service to 6 counties. We have 7 sites in 6 counties. And we provide primary health care for children from 0 to adults 99, 100 years of age. So on a daily basis, we service a little over 16,000 patients throughout our entire service area of the 6 counties. We provide pediatrics, family practice, women's care, behavioral medicine, dental services. We have our own pharmacies. We do labs at our site. So It's pretty much a one-stop shop for our patients.
I think whenever you're able to do something like this, in our case, in this school district, it serves as a platform to attract other programs. And we've got some program directors that will talk about other programs and services that we're bringing to the Mathis community, and it is as a consequence of this partnership. We were able to see what we were able to do with this partnership, and from that, other programs grew.
So one of the projects that stemmed from the Community Health Center was our PREP program. It's a personal responsibility education program. So we're working on preventing teen pregnancy prevention through positive youth development. So we are working with some of the 6th and 7th grade and also 9th grade students here at Mathis ISD, and also some other local ISDs in the area. That's been one of the biggest benefits. Actually, all of our pregnancy prevention programs are in our rural communities because they don't have some of the access to different extracurricular activities, some of the things that sometimes in our urban counties you see. So this provides them an extra avenue and something to really give back to their communities and feel a sense of purpose. Just that we're very grateful that everybody has been so welcoming bringing a teen pregnancy prevention program, and so we're grateful that everybody has been very open, just been very open to the program.
We're rich of talents, and I gotta tell you, these students go usually from 7:45 all the way till 6 o'clock. They put in almost 11 hours. This is a mariachi class that is done after school from 4:30 twice a week. So I'm very impressed with their talents. It's not like big high schools, they have a mariachi class. They put the extra time. Most of these kids, raise up your hand if you are in International Study School Network. Raise up your hand if you are in pre-AP or AP classes. Raise up your hand if you are in UIL events. National Hispanic Institute. Many of these kids wear many hats. We're a small campus, but very honored, and that you always keep us in mind. I felt very honored. This is several times that you have visited our school, but our kids remember you. And I want you to know, every time they know that you're coming, they get excited. So these people wanted to sing to you and to serenade you because you're here, and it means a lot to us. So keep us in mind. Anything you do over there in Washington, keep Mathis in your mind and your decision making.
Well, thank you. And a special thank you to all you students who performed again for me. I get excited too. In fact, when we were driving up from the valley, I mentioned to Congressman Becerra, well, maybe they'll have mariachis because last time they played for me and they were really, really good. But I think probably now is a good time to talk about our visit because I think it's important for you students to know why we're here and so that I can introduce you to my leader, and I'll explain that in a minute. But we represent different parts of the country in Congress. And of course, representing South Texas, it's very important for me to let other members of Congress around the country know what a great place we live in down here. But it's also important because a lot of the things that we've worked on from a policy standpoint have a real impact on the lives of people back home. And so today, when we talked about Congressman Becerra, who's from Los Angeles, coming down, before we planned this trip, I mentioned to him, we have a very dynamic programs that help, the Head Start programs that help our kids before they're in kindergarten. We have robust community health centers, and when I called Mr. Aiken, I said, I really want to take Congressman Becerra to Community Health Center. He said, well, we have that Community Health Center at the school district, and what we saw today is that Mathis Independent School District and the Community Action Network are on the leading edge of providing health care not only to your students, but to the entire community. And when you're shaping federal policy in Washington, and you come home and you see that what you do has a real impact in the daily lives of our children, of our parents, and our elderly, it makes you feel good about going back. But a little bit about our guest today. Javier Becerra and I are about the same age, but I've been in Congress for 13 months, and he's been in Congress since 1993. And so, you've taken lots of government courses, so you know that in the House of Representatives there are 435 of us. There are approximately 230 Republican members of Congress and 201 Democratic members of Congress. And each of our caucuses, the Republican and the Democratic caucus, has its own leadership system. And to give you an idea of how important of a job Mr. Becerra has, Nancy Pelosi is our majority leader. Our minority whip, he's the guy that kind of keeps us in place and makes sure we're doing the right thing all the time, is Steny Hoyer. And then our assistant leader is Mr. James Clyburn. But the fourth ranking Democrat in the entire House of Representatives is Mr. Javier Becerra.
Wow, that's excellent.
Some of the people that we work with in Congress would like to cut programs like community health centers and Head Start. What we do is we do everything we can to ensure that the federal government continues to make funds available so that you can keep doing the good things that you do. But Congressman Becerra has been a champion of those efforts for a very long time. And so it is my pleasure and my honor to welcome here to Mathis.
Welcome.
Well, first let me just say that I used to play the trumpet too when I was younger, and I think there are a few folks here who could go to the X Factor and do a little bit of singing there and maybe see what their chances would be. It'd be great to see. Or to American Idol, whichever one you want to do, or The Voice. All I know is that there's some talented people that show up, and what I heard was fantastic, and I hope you continue. I hope you continue. I am thrilled that Congressman Vela gave me an opportunity to come visit with you. I'm so appreciative that he thought it was so important that in my 2 days in South Texas that I should come to Mathis and visit this school and visit this clinic. It shows you the priorities of your member of Congress, that Congressman Vela believed that of all the things that we could do, this is where we should be. And I think he's right. And going through and seeing everything you do with the few resources sometimes you have, it's very impressive. So when you can combine good health care, good teaching, opportunities outside of the classroom, and put it all together, you really have created a village that's very, very strong. It reminds me of back home. Your tias, your tios, your cousins, you all get together all the time, and that's because you're a family, and this very much has the feel of a very close familia, and I think that's very, very important, and that's probably why you have such success. You also have some tremendous leaders who make the investments to be here, and I think we should always pay a tribute. So maybe we should give all the leaders who make it possible for us to have the clinic, the school, the mariachis, a round of applause for what they do. And I simply want to close by saying this. It makes no difference where you go in the United States of America, and I have the good fortune to travel to a lot of different places as the chairman of the Democratic Caucus in the House. You always know where there's success. It's where people believe they have to invest early in their children. And to see the talent, the voices, the playing, it's clear that there are people here who are investing in their children. And I think that's great, and that's the way it should be. But don't forget to invest in your leaders who make it possible for you to be able to do these things. And that's where I want to mention how fortunate you are to have Filemon Vela be the member of Congress who represents this area of Texas. I believe that you have in Congressman Vela someone who understands very well how Washington works, but who also believes that it's important to let Washington understand how South Texas works. And so long as you let us come visit, we will come. And I hope every time we have a chance to come visit here, the mariachi will be available to greet us, because that sure makes you feel like as far away as you might be from home, and as far away as I might be from my wife and my 3 daughters, I'm with my family and I am at home. And I thank you very much for opening your doors, and for all of the students for taking the time on what could otherwise be a nice evening to enjoy all sorts of other things, to be here to play for us. Thank you all very much, and continue the success with the clinic. Next time I come down, I hope to see it 3 times the size as it is right now.
You're invited.
And we'll be looking forward to that. Thank you very much. Well, I'm pleased that Congressman Filemon Vela invited me to come to South Texas, and one of the things that he said it was important to do was to come visit one of the community clinics, health clinics, because healthcare is a very important thing, education and healthcare. And in this case, at the Mathis Elementary School, we were able to visit both a school and a community clinic located right on the school grounds. And so it was fantastic. We got to see everything they're doing to try to help keep those kids healthy. We saw everything that those families are doing to try to take advantage of the fact that all these people, all these professionals are dedicating themselves to keep their kids healthy. That was great. Well, my district, like Congressman Vela's district, is the 34th district, but in California, not Texas. It's in Los Angeles, the heart of LA. And like South Texas, I have a lot of folks who work very hard, but don't often make enough money to buy their own insurance and have a hard time making ends meet sometimes. And so we work very hard to make sure that we give them an opportunity, if they work hard, to be able to send their kids to a decent school, to get that health care that they need, but most importantly, to hold on to that job. And I'm very fortunate that my wife is a physician, and she has shown me so much about what it means to care for people and cherish life. And so for me to be able to come visit a school that has a community clinic, I got to go home and tell my wife I just saw another place where great things are happening for future leaders of America. Well, you know, it's really great when you come to small towns like Mathis and you see how much it means to them to see their Congressman Vela, who works so hard for South Texas. And then they treat me like a king, they treat you like your family, and it's phenomenal. And perhaps the best part was to listen to the young students who were mariachi players. To me, mariachi music it brings me home. And I was a trumpet player once, and I was watching those trumpet players intensely. It's another sign of the gratitude that people show when you come and visit. This is my job, and it's Congressman Vela's job to try to make things better for all Americans. So it's great that for just doing my job, I get treated to some great mariachi music by these students. Indispensable to invest in America. Indispensable to believe that Americans are ready to create that next generation of middle-class Americans. It's indispensable to continue to work with all families, all Americans who are working hard to make sure that their kids have an opportunity. In some places, they don't have as many assets, there's many jewels as others. And I went to South Texas, to various places, and I saw jewels everywhere I went, especially in the faces of these young kids. I see America, and I see the brightness of its future, and I hope that what we do as policymakers, people who have a chance to make decisions for all these Americans throughout our country, will recognize that we can make investments that will change our country for the better.
Well, as we make policy decisions in Washington, for example, related to the funding of Head Start, the community health centers, to me it's real important to know what the real impact is back home. So when we talk about organizations like the Community Action Network that runs a series of Head Start programs and community health centers throughout rural South Texas, it really helps to go talk to the folks who work there, the folks who benefit from those programs, because it gives you some grounding when you go back to Washington and make some of these decisions. From the standpoint of the administrators who run the entire program, from P County all the way down, to Webb County, the Star, and Hidalgo County, which is about a 3.5-mile radius, to the nurses and physicians and other healthcare providers that work on the spot, or with respect to Head Start, the teachers who take care of who teach the pre-kinder students that benefit from those programs. When you sit and talk to them about what they do every day, in and out, it just gives you gratification, because you know that when you're fighting to make sure that we can continue to fund those sorts of programs, that you're doing the right thing. Well, Congressman Becerra is the 4th ranking Democrat in the entire House. He is the leading Hispanic in the House of Representatives. And he has been an advocate for community health centers and Head Start programs since 1993. And I thought giving him the opportunity to come and see South Texas was a good thing for my constituents. And I think it was rewarding for Congressman Becerra, myself, and everybody else who participated in today's events.
This show is dedicated to the men and women that help community action grow in South Texas. And this is a shining example for the congressmen, for the representatives of every state, including the senators, for our president, and for healthcare advocates to see what works. This model that we've seen of community action with the doctors, mid-level practitioners, nurses, advocates, educators, school board members, and parents and children alike that all come together. This is the type of clinic that is needed everywhere, not just here, that can be applied in Montana, it can be applied in Wyoming, it can be applied in New York, Florida, all throughout the United States. This is the kind of medical model that works. We've got to think outside the box, and my comments are addressed to those who can help be change agents, which we all can, in the healthcare system.
YouTube and
Yeah, there you go.
so this is our
They like to shake your hand.
Great.
You don't mind.
Javier. Javier.
How you doing?
Hey there.
How you doing?
Congressman? How you doing? Let's get him turned around. Can we do that? How are you? Congressman Vela?
A really interesting approach to developing better health care for people in rural communities so they can have access to things that are so easy to come by in larger communities. And this particular clinic is partially federally funded, but also funded through members of the community trying to help out. And it's a format like this that can be taken to other rural areas and help people there too. For Hola Tejas, I'm Mireya Garcia.